Well, too. So, treating IBD in 2015. So, we have many times showed this slide with IBD in the middle and saying, you know, you have a genetic predisposition to some type of environmental trigger and an immune system malfunction. And the treatments that we've had so far are really aiming at correcting an immune system malfunction. And it's important. A lot of patients say, well, I don't want to be on a medicine that affects your immune system. And my response is, well, yes, you do, because your problem is your immune system. But you do need your immune system. So while Dr. Rubin brought up the point about people being cured of cancer and being cancer-free, you don't want to be immune system-free. That is called an acquired immune deficiency, which you can probably figure out what the acronym is. But nevertheless, you want your immune system to be balanced and in control. So I'm going to walk you through some different ways that we've tried to do that. There are some approaches that prevent the immune system from even being activated to attack you, to prevent the immune system from expanding to bring in more immune cells, because that's kind of what they do. Some therapies are aimed at killing the trouble-making immune cells while leaving the rest of the others alone, so you're protected. Some of the newer therapies actually selectively impact the immune system only in the gut. And believe it or not, there are attempts at creating a new immune system. So let's look at the first one. Prevent the immune system from being activated. Trick the immune system. You may be surprised what I'm going to show you next. First is probiotics. So Lori gave us a nice little spiel about probiotics. They are live organisms that are felt to be beneficial, that have evolved with humans over millions of years. The benefits are not just nutritional. And many people refer to them as the good bacteria, and when we say bacteria, we mean yeast, bacteria, and some other organisms that crowd out the bad ones. And it's important to develop a healthy immune system. As Lori already mentioned, lactobacillus is common in yogurt and other fermented dairy products. Bifidobacterium is found in breastfed infants and is also common in dairy products. Saccharomyces is another protective organism, and there are others as well. When I talk about yogurt, I always, if those of you old enough to remember this commercial they had for one of the yogurt companies, said, well, one of Soviet Georgia's senior citizens thought the name of the yogurt was an excellent yogurt. She ought to know she's been eating yogurt for 137 years. Exactly. I'm not going to make any comments about the girl I dated in college, but nevertheless, in IBD, however, the probiotic data has been disappointing so far. Hopefully that'll change. The second thing is worms, fooling the immune system. Countries that are red have high rates of autoimmune disorders on the left. Countries that are red on the right have high rates of worm infections. Notice they don't overlap. We have evolved. I personally have not evolved, but we humans have evolved with worms inside of us for millions of years, and it is thought that there may be a benefit of having a worm. So the worms, yes, I know, fools the body. Actually, it fools the white blood cells, or macrophages, and it fools what are called the dendritic cells, which are the ones that sample the gut to try to decide whether to attack or to leave it alone, and actually can calm down the immune system. And it might actually be beneficial. So perhaps, and I use this joke quite often, people ask, well, why do we have Crohn's disease? I'm like, well, it's your mother's fault. She should have let you play with that kid in the sandbox, the one who was, picking up the cat poop. Speaking of poop, the other way to fool the immune system may be doing a fecal transplant, taking a stool from a healthy donor, given to the patient by enema, by tube, believe it or not, or by colonoscopy. Dr. Rubin has been an expert at this, calling it rebooting the gut microbiome, the ultimate probiotic. This is effective in treating an infection. People who have recurrent C. diff, Clostridium difficile infections. It actually works in 80 to 90%. The data, though, in Crohn's and colitis has not been as promising. And some patients do get worse. And please do not do this on your own. Believe it or not, I have had numerous patients who come in and redefine what marriage vows are all about.